Good afternoon. I have created this presentation to outline the aspects of my educational experience at CSU that were beneficial toward my career as an EMS educator. Throughout my journey here at Colorado State University, I've come to believe in Kismet. The timing of the learning events throughout the program seemed to align with opportunities that I encountered in my professional life, and that provided me with the skills and the knowledge I needed to be successful in those particular endeavors. When I wrote my statement of purpose as a part of the enrollment process, I had hoped the AET program would unlock my potential for instructing adults by harnessing my creativity and passion for my field. I couldn't be more pleased with the outcomes. As a result of my experiences, I learned how to conduct quality research in a methodical, organized manner and leveraged my foundational knowledge of education by participating in intellectual discussions with other professionals from a wide variety of backgrounds to broaden my perspective. If I had taken a program closer to home, I would not have had the exposure to the breadth of cultural differences I found at CSU. Ultimately, I identified instructional design techniques from the Dick and Carey model to improve the delivery of education to my students and created new facilitation methods to enhance learning transfer that included a wide variety of technology. In the book, The Courage to Teach by Parker Palmer, I was reminded that teachers possess the power to create conditions that can help students learn a great deal. But good teaching requires that we understand the inner sources. The 624 Adult Learning and Training course taught me to trust myself despite the vulnerability teaching brings and embrace the fears of the unknown or new with openness. Currently, I am reading The Tao of Teaching by Greta Nagel, and I'm enjoying the reinforcing philosophy of a holistic, learning-centered community. With the help of fellow classmates and facilitators, I have developed a subject-centered community of truth and value a classroom of mutual inquiry with confidence and the integrity of my true identity to self. That change in perception allowed me to look at education through another lens. I learned that creating a variety of activities that engage all learning styles can improve learning transfer. So I designed visual aids, experiments, group projects, and immersive simulation events to encourage collaboration and discussion of past experiences to relate them to the present lesson. I hate math, so the one class I dreaded most out of the entire curriculum was research methods. But I was pleasantly surprised. In working step by step with faculty, I was able to investigate an issue I was encountering with the use of simulation as a replacement for clinical internship. The study revealed that it might be suitable to replace some amount of clinical hours with simulation for those high criticality but low frequency patient encounters and provide opportunities for students to practice medicine without fear of causing harm to a live patient. And just as I had mentioned in the beginning, it seemed as though opportunities appeared for me at just the right time. In this case, I was able to lead a research event on the effectiveness of ketorolac, or Toradol, in patients suffering from isolated musculoskeletal injuries requiring transfer out of difficult terrain to a receiving facility. Colorado State University reintroduced me to the theorists and their philosophies on education that I had initially learned in my undergraduate courses. However, my undergraduate studies did not create the impact on the importance of these individuals toward education. The Adult Education and Training program gave me an appreciation for these individuals and taught me how to implement theory into practice. In order to be successful, the EMS student must have a rooted infrastructure of skill development and mastery that ensures compliance with the expectations of many governing bodies. As a result, a portion of the curriculum is delivered in a behaviorist format that allows learners to develop a sound basis for the constructive and progressive educational components of scaffolding and assimilation. From my study of Dewey, Bruner, Auzubel, Piaget, and Mayer, I found methods to improve student buy-in and ownership of the learning experience through discovery and active experimentation. As an instructional designer, I look at the job as an art form influenced by many shifting parts. Those parts include the culture, stakeholders, students, the goals and objectives, and the environment. The devil is in the details. Adapt and overcome is standard verbiage for EMS personnel, and as educators, we need to do the same. A willingness to remain fluid and adapt our strategies and overcome the challenges identified from continual analysis of the students and the environment. I need to be willing to change and take action, even if it means scrapping what I have already developed. Those details include an evaluation of the learners based on Knowles' assumptions, a view of their self-concept, reservoir of experience, social roles, and motivation. Even though I've been developing my practices over the past 15 years, my time in the AET program helped me to identify areas in need of improvement. One of those areas was the delivery of an organized, concise instructional planning guide based on a thorough analysis of the prescribed goals, topics, and objectives. Even though I had this previously in place, my education here at CSU showed me a more precise method for selecting and sequencing activities to assess learning. This is an example of an instructional planning guide I created for pharmacology. This course, in particular, can be challenging for some because of the abstract nature of the material and a lack of solid foundation to build upon. To improve success, I played to the different learning styles using VARC to create two distinct paths for optional assignment completion and kept some material as mandatory. The two options allow the students to choose what would work best based on their learning style. Another area that I sought to improve upon was assessment and evaluation. By developing a peer review evaluation that mirrors the instructor assessment report, all learners become actively involved in the simulation event and critiquing process. Plus, I developed a student simulation experience report that outlines guiding questions to help participants to reflect upon their patient encounter and develop and improve individual reflection practices and critical thinking skills. My professional life continues to evolve throughout my career here as a student at CSU. I was promoted to EMS Programs Coordinator at New River Community and Technical College and undertook a great deal of additional responsibilities. While that might have made some people slow down on their personal education, it made me push harder. I forced myself to continue forward because I saw immediate value in the lessons I was learning toward my job as a coordinator. In addition to the change in my employment status, I was also honored with an opportunity in the fall of 2014 to speak at the National Association of EMS Educators Annual Symposium. I chose to speak on web-based solutions for lesson plan development, a topic I wouldn't have been prepared to delve into if it weren't for the confidence I had gotten from my time in the AET program. When the opportunity to develop a lab manual for anatomy and physiology presented itself, I jumped at the chance. Leveraging my skills in the facilitation of learning developed at CSU, I created a manual that focused the purpose of the chapters into meaningful learning opportunities for EMS professionals. As an educator, my responsibility toward continued professionalism will not stop here. I continue to remain involved in the National Association of EMS Educators, as well as the National Association of EMTs and the National Registry of EMTs. As a pre-hospital provider, I remain relevant to the field of EMS by working as a paramedic each summer at the Summit Bechtel Reserve Boy Scouts of America in Mount Hope, West Virginia, patrolling the site and responding to visitors suffering from serious injury or illness. Most recently, I accepted the position of Assistant Chief of EMS for the Mount Hope Volunteer Fire Department, where I focus on leading the new generation of EMS providers through ethical practices. As for my future after graduation, well, I look forward to spending quality time with my husband and son after graduation from the AET program and get back into some of the activities I enjoy. However, I also hope to continue developing my curriculum in an effort to improve the educational opportunities in my region. Over the next 5 years, I also plan to continue participating in the National Association of EMS Educators by attending their annual symposiums and participating in the Educational Technology Subcommittee. Plus, I am looking forward to dropping back in at CSU and taking the experiential learning course over the summer. Within the next 10 years, I want to pursue a PhD in higher educational leadership with a goal to influence positive change at a legislative level to develop more effective EMS education.